What if your fingernails were trying to tell you something important about your lung health, and you had no idea? Today, we're talking about nail clubbing, one of the most overlooked and least talked about signs linked to lung cancer. Nail clubbing, also called digital clubbing or Hippocratic nail, is a physical change in the shape of your fingernails and fingertips that develops gradually over time. It is primarily caused by an overgrowth of connective tissue and accumulation of fluid in the nail area, leading to enlargement of the terminal portion of the fingers, or toes, as well as increased diameter of the nails. Here's what to look for: softening and reddening of the nail bed, nails that curve downward over the fingertip, fingertips that appear wider or swollen, a shiny appearance to the nails with a spongy feel when pressed. So what does this have to do with lung cancer? Lung cancer is responsible for about 80% of nail clubbing cases, making it the most common cause. Healthline nail clubbing is seen in about 35% of patients with non-small cell lung cancer and around 4% of patients with small cell lung cancer. Healthline. In lung cancer patients, nail clubbing happens because of increased blood flow to the fingers. This extra blood causes fluid to build up in the soft tissue at the tips of the fingers, making them swell and look rounded. Knee. The most common cause of clubbing is lung cancer. However, like most symptoms of lung cancer, clubbed fingers may not show up in the early stages of the disease. That's what makes awareness so critical. Here's a simple self-check you can do right now, called the Schamroth Window Test. Place the backs of your 2 index fingers together at the nail. In healthy nails, you should see a small diamond-shaped gap at the base where the nails meet. One lung cancer patient shared that their only symptom was clubbing of the fingers, where all fingers swell up, and when you put your fingers together, you cannot see a diamond. No diamond gap? That's a reason to speak to your doctor. If you notice nail clubbing, here is what to do. Don't panic. Nail clubbing can also be linked to other lung and heart conditions. Do not ignore it. If a person notices nail clubbing or other changes to their nails, experts recommend contacting a doctor. Ask about lung cancer screening, especially if you smoke or have risk factors. Remember, nail clubbing can be reduced or reversed if the underlying medical condition causing it is treated early. Your body communicates with you every single day. Nail clubbing is one of those quiet signals that deserves your attention. Look at your nails, do the Schamroth test, and if something doesn't look right, speak to your doctor. Early awareness saves lives. Like, subscribe, and share this with someone who needs to see it. See you in the next one.